Welcome to Medicine Redefined. I'm Dr. Altamash Raja.
And I'm Dr. Darsh Shah. Let's put the health back in healthcare.
If you're a high performer who wants a clear plan for longevity, performance, and staying active with fewer setbacks, I'm now seeing patients through my telemedicine practice, Refining Health and Performance. I'm opening a limited number of founding member spots at refininghealthrx.com. All right, let's jump in.
Dr. Tanuja Sharma, thanks so much for coming on to our podcast.
Thank you for having me.
So I want to get right into it because you're obviously done something very incredible that I actually thought about in my third year when I was in Fayetteville, North Carolina, rotating through Cape Fear Hospital System. And one of the things that jumped out to me early on during those rotations was, as you round, you start to see what's on the trays for the patients to eat. And you kind of take a step back, especially when you're talking about diabetes and cardiovascular disease. And so much of this is rampant. And you think about, how do we change this? And I was so close to actually, emailing the CEO or whoever I could to be like, hey, is there something we could do? But then I realized, well, I'm only going to have a year here. So I don't know how much I can actually get done. But you've done it. You've done this at Tampa General Hospital. So I'll just let you take it from here. Where should we start? Take us through how this was accomplished.
So I started very similar story. So I started rounding at the hospital about 2-3 years ago. And I have a background in nutrition and, board certified in family medicine and integrative medicine. So food is medicine and using lifestyle and prevention is a passion of mine and the way I see, healthcare. And when I started rounding, I was really disheartened by the food that I would see on the trays in front of patients. And I remember one in particular that had 4 or 5 little cans of soda just lined up. And she, was fighting for her life. She was chronically inflamed. And I'm looking at the food and saying, we're really feeding patients really inflammatory, ultra-processed food in the most critical time. Like these patients are fighting for their life. We see a lot of sick patients at TGH. It's a level 1 trauma center. The length of stay is really long. We do a lot of transplants. And so we see really sick patients and they're in an acutely inflamed state and we're feeding them inflammatory food. And, it's a common issue amongst all hospital systems across the nation. And our food industry has just really changed a lot over the years. And ultimately, the hospitals are under a pretty tight budget to feed hundreds, thousands of patients. And feeding ultra-processed foods that have a long shelf life that meet the dietary restrictions and the limitations in the hospital has just become the norm. And I really think having access to whole, nutritious, real foods should be a fundamental right. So I met with our CEO, who is very informed, progressive leader. And I'm really grateful that he's really supportive of all lifestyle and integrative modalities and that even Tampa General has an integrative medicine department. And I kind of reviewed the data, reviewed what some of the centers in Cleveland Clinic and some other big centers are doing in terms of food. And said, we really need to change the food that we're feeding our patients. We're kind of causing more issues, more inflammation while they're sick, while we're trying to heal them. He was on board. He was really supportive. He connected me with our dietary team. And it was just perfect timing because at the same time he had met Jeffrey Zakarian. He's a celebrity chef on Iron Chef and Chopped. And him and his family moved to Tampa during COVID. And he said, Dr. Sharma, you're meeting me at a good time because I just met with this chef and I'm thinking that we should collaborate with him. And I said, wow, this is amazing. Not only can we change the food, but we're going to have a Michelin-rated chef helping us curate the menu. And so it was a big team effort. It took a couple of years and it was a group of, our chef, the chefs that we currently have at the hospital, our dietary team, our nurses and physicians. We met monthly and we completely changed not only our food and the menu, but the way that we serve our patients. And so the menu is now all based on the anti-inflammatory and Mediterranean diet. We got rid of all of our previous ingredients. We're exclusively using extra virgin olive oil as the main oil. No seed oils are used. We're using organic produce for the dirty dozen at least, or when we can. And we're collaborating with local farmers just to make sure that our food is seasonal, local. And there's a lot of evidence to support that. The shortest the distance your food travels from where it's grown to your mouth, it's tastier, more nutritious, healthier. And so we created a very vibrant, colorful, healthy, whole food, nutritious menu. The reason why we chose Mediterranean anti-inflammatory diet is because the research is extensive, and the properties of it, why they make it so beneficial is it's rich in unsaturated fatty acids from the extra virgin olive oil and the nuts and the seeds. And that reduces LDL oxidation, reduces your LDL, increases your good cholesterol, your HDL, so it helps and supports preventing chronic diseases. There's a lot of emphasis on fiber through lentils, legumes, which is really beneficial for helping with the gut microbiome diversity. It is rich in fish with another source of omega. It's limited in animal protein, and it's really rich and vibrant in fruits and vegetables. And colorful fruits and vegetables give you phytonutrients and polyphenols, which are rich in antioxidants and anti-inflammatory benefits. So this combination of the monounsaturated fatty acids, the antioxidants and polyphenols, and the fiber, in a combination help to diversify the gut microbiome and modulate preventing chronic diseases, improving insulin resistance and inflammation. And so our menu is beautiful. You can share it on your podcast. I don't know if you can share images, but it's delicious. And there's tons of options for everyone. There's something for everyone. There's something for vegetarians, for people that don't eat meat. We have a lot of yummy milkshakes and protein shakes and smoothies, which are important for our pediatric patients and those that have swallowing issues or uncertain swallowing precautions. There's tons of our plant-based options. There's a vegetarian chili, there's soups, there's a falafel, there's pita wrap, there's quinoa, there's a meze platter, and there's one that's specifically I designed with our chef, and it's called Dr. Sharma's Mindful Mix. It's kind of like a charcuterie board minus the meat, but it was inspired by my family and my mom specifically and my aunts, because we would have just dried fruit and nuts on our counter, on our island, just kind of there all day just to graze on. And so the Mindful Mix plate has 3 Brazil nuts, which is monounsaturated fatty acids, rich in selenium, which is good for thyroid, some walnuts, dried fruit, which gives you the fiber, satiety, a piece of Parmesan cheese, olives, and fruit. And it's become one of a really popular, healthy, yummy snack plate.
Nice.
But yeah, I encourage you to look at the menu. It's beautiful, it's tasty, and good for you.
Yeah, I mean, if you look, and I encourage the listeners as well, go on the website and actually look at the menu. I mean, it looks like a restaurant, right? Like when you're walking in, like the pictures are vibrant, everything. It makes you want to actually go to that hospital and order. And is this only for patients or is it also for employees?
So currently we're offering it to patients, but our hope is that, because we just launched officially in October, and now the menus, the entire hospital. Eventually we're hoping to add it to our lounges and then the cafeteria.
Gotcha.
One thing about the menu that was really important to us is the education piece. And so we educated our staff and our nurses on the menu, on the reason why and the philosophy and the why behind the Mediterranean anti-inflammatory diet. And on the menu, we included little nutritional blurbs and just kind of information about the message behind each menu item, because we really want to have patients feel empowered and motivated to continue on outside. You know, we see them for a short time in the hospital, but really the work is going to be implementing these lifestyle changes on a regular basis. And so the education piece, educating our nurses, educating the patients is important. And we've included the recipes and all of that so our patients can feel empowered and so we can all share the same message.
No, I was just going to say, this is so amazing. I'm actually looking at it. It does look delicious. I'm not going to lie. So do you know any other hospitals in the country who have a similar process, or at least have paid attention to their food the way that you guys have? Because I agree. I've been up and down the East Coast, and I've never been in a hospital system that has cared for that. That's been a point of impact for them.
Not to the extent of, working with a celebrity chef and completely changing our menu. There are some organizations like Cleveland Clinic that have emphasis on their food and have more healthier options. But this is truly a kind of movement and a change of philosophy in what we're serving our patients and making sure that we're all speaking the same message. One big thing that we have also done is we no longer serve soda to patients. This was something that we've been trying to do for a while, and we still have the vending machines and we still have it in, the cafeteria, and family members of patients, want it and it's their last dying wish. We still have it available. But as a part of our menu, in terms of what we're serving them, we've gotten rid of soda, which is a huge accomplishment and what we've been trying to do for a while.
It's pretty awesome. So, the common question is, well, why aren't hospitals doing this? You mentioned that hospitals run on razor thin margins. Everything's always about the bottom line, oftentimes. Can you take us through a little bit of the status quo of what hospitals are doing, right? What TGH was doing pre-Mediterranean menu. Obviously, we have certain restrictions, right? Like sodium restricted or fluid restriction, carb controlled. Take us through a little bit about what those means, just so the listeners can kind of catch up and with an understanding.
Yeah. So over the years, our food industry has changed. Our farming methods have changed. There's more preservatives. The soil in our ground has changed. And over time, our food has just really changed to ultra processed food. And it's the most accessible. It's the cheapest way that we can get food. And as I mentioned previously, hospitals, are feeding hundreds, sometimes thousands of patients, and they have to do this in a budget, and they have to meet the requirements of certain diets and a certain shelf life. And in reality, processed foods have a longer shelf life because of the preservatives and extra, additives they add. And so it's just easier in that way. I don't think along the ways they realized how bad it was for you. And, I think the research and data is more strong now, but I think while it was happening, it was just like, this is the easiest option. This is what we can do. I'm grateful that we have a great administration and leadership at TGH that puts a focus on wellness and prevention and using food as medicine. There's a lot of initiatives that we have in place around lifestyle medicine. So we, are probably one of the first in the nation to do something like this. And we are really hoping to, share. We would love to share our menu and we would love to share what we're doing. I think our next biggest step is doing the research on the menu and the outcomes.
So such a big change. And anytime there's change like this, there's always pushback. Talk a little bit about what that was like. Were your colleagues immediately on board? If there was pushback, what were some of the opposing points of view?
To be honest, there wasn't too much of a pushback because I think the stars just kind of aligned when I approached our CEO and he met this chef and we were already having conversations of slowly improving our food. I think the biggest challenge was the budget. And we're obviously using like whole nutritious foods, good quality meats and fish, extra virgin olive oil. And what we've done to try to keep budget neutral, which was our goal from the leadership and board, is we are offering many less items. There was a lot of wastage before, and our menu was extensive. In even our nurses station, we would have, sandwiches and Jell-O and just extensive amount of snacks and other things that weren't being utilized, or there was a lot of wastage. And so one thing that we've done is really just reduce the amount of options. There's something for everyone, but there's not going to be as much waste. And then the other thing that we're doing, we are moving towards a menu service style. So patients will call when they want their food instead of having set times. And as you know, in the hospital, you're pulled for a procedure, might still have the effects of anesthesia, not be awake when your tray comes. You might be MPO. And so there's a lot of wastage of food in general in the hospital. And so when patients are ready to eat, they will order what they want to eat, even if it's just a soup or a falafel pita or a chili or whatever it may be. They'll order what they want when they're hungry. And so we're hoping to show less use of wastage.
So oftentimes in the rehab hospital, at least, right, for inpatient rehab, the dietary team and us care a lot about the calories, right? Because they're working out, they're doing intensive therapy 3 hours a day. We don't necessarily care what goes in their mouth. We just want them to get something, right? How much of that is in the thought process of, some of these critical patients? Is it just, we need them to get something down versus, more of a healthier food option?
Sure. So that's why we have stuff on the menu like the milkshake, but they're just made with like healthier ingredients. We did a lot of research to find the cleanest, ice cream available that we could get. And it's just, we're using the cleanest ingredients that are the least, inflammatory with the least amount of additives. But we have something for everyone. We understand that there's a lot of patients that have failure to thrive or they need to put on the calories. And so we have options for them as well.
Very cool. Is there, moving forward, when you kind of think about next steps, you talk about research, you talk about these things, has there been any pushback from the patients, especially when they're used to their home foods or they want that soda? What are those discussions like, with patients and the staff or even you?
Yeah, we're getting overall positive feedback. It's still pretty new and we're, meeting monthly to kind of get more and more feedback and discuss it. But the initial feedback that we've received is promising. Patients are really enjoying a lot of the meals. It's tastier. We are trying to improve our speed in terms of when they call and get the tray to them. Sometimes patients aren't familiar with some of the ingredients and some of the menu items, or it might look like something they're not used to eating. And so that's why we have a lot of education with the staff and the nurses to educate them on, to try it. And we try to promote trying it. So that's been a little bit of an issue, but overall, once patients try it, they are enjoying it.
Tanuja, I'm really excited to kind of see how, when you do implement this into some of the research and we kind of track that outcome data, have you been tracking some outcome data? Is that out there preliminary? Like, just if you can't share, that's okay. But if you can, I'd be interested in hearing that. And my second part of the question would be, with respect to designing a study, something like this, maybe just a cohort stiff so you can kind of publish it, maybe present it in different hospitals, but say, hey, look, this is actually helping, right? Because we talked about this concept of food as medicine. That's what you're passionate about. And you say that, and a lot of people know that, yet the application of it is so hard, right? So Darsh talks a lot about how our environment is just not built to be successful, right? So if somebody comes in, they spend, I don't know, let's just say 5 days in the hospital setting. When they go home, it's like, how much of an impact did those 5 days make? Obviously, if there's an extended stay, if you have an ICU stay, if somebody's in rehab for 3 to 4 weeks, maybe we can talk about that maybe it's making a significant impact. But I'm curious from your perspective, as you're implementing some study to look at outcomes to make a case where this is actually medicine, if we're going to worry about the appropriate doses for vancomycin, we should also care about this. What are some of those outcomes that you look for?
Sure. We haven't collected any data yet because we just started implementing the menu, but we did have a meeting with our research scientists and that's one of our next steps. We're hoping to look at inflammatory markers like CRP. And to answer your question and the importance of, what are patients going to do afterwards, we talked about a flash freeze program and freezing some of our foods and having that delivered. So that's one thing that our organization is looking at and we're passionate about. And we have a whole other organization within TGH called Tampa Well. And Tampa Well is under our wellness committee. They have collaborated with a group of over 300 organizations around Tampa, and the ultimate goal is to make Tampa a wellness destination for all. And one of the things that we do at our health park location, we have a health park location with a primary care and some specialty groups, but we've created a food pharmacy and a community garden. Our community garden is run by a wonderful farmer. Her name's Janice. And the garden consists of whole foods, fruits and vegetables that she is growing. And our food pharmacy has fresh produce. And the way that the system works, we have 2 programs. So patients that are seen in the health park clinic by primary care provider, if they fill out a questionnaire and if they meet criteria for food insecurity and and have a chronic condition like prediabetes, they will be referred to our food pharmacy. And at the food pharmacy, we have 2 programs. One is through YMCA and one is through Tampa Well. And basically they get free produce. One is weekly for 12 weeks and one is twice a week for 12 weeks to 6 months. But we are giving them free fruits and vegetables. And along with this food prescription through Tampa Well and the food pharmacy, they have access to Janice, our farmer. They have access to monthly educational menu demonstrating recipes. There's a whole team. We have a mindfulness lawn where we offer yoga classes. So when you get this prescription, it's not only prescription for free fruits and vegetables, but it's a prescription to this whole community. And we targeted that area code next to Hillsborough because they are patients that need it more and kind of meet the requirements. And so with Tampa Well and access to our food pharmacy and garden and the Flash program, we're hoping to continue our message and the importance of prevention when patients leave the hospital too.
Cool. Awesome. I absolutely love that. I mean, that's phenomenal. Talk about continuity of care from, a lifestyle medicine perspective. I mean, that's critical. Now, you talked a little bit about your board certification in integrative medicine as well. And so you practice that and you're the medical director and you are the medical director of integrative medicine and arts, right? At TGH? Okay.
Yes.
Operationally, some people might not be familiar. I guess maybe step one, if you could describe in your terms, simple terms for the listener, what integrative medicine is. There's so many terms out there. And then two, what does that mean at a hospital level for those clinicians listening and maybe their department or their institution doesn't have an integrative medicine department?
Sure. So integrative medicine in simple terms is looking at the patient as a whole and combining all aspects of their life, including, their upbringing, mind, body, spirit, physical, social, and physiological and mental, and just looking at all aspects. We work closely with conventional medicine as well. Sometimes patients mix up alternative and integrative, and alternative is, its own entity that doesn't automatically connect and work with conventional medicine. But integrative, we work with all multidisciplinaries, and integrative medicine is all evidence-based. And so all of the studies and research and techniques that we use is based on evidence. And so in the hospital settings, there's different forms of, hospitals that might practice aspects of integrative medicine, but most of the benefits and research comes from an outpatient setting because a lot of it focuses on lifestyle and prevention of chronic diseases. In the hospital setting, as you know, right now, it's all based on acute care, acute illness, and in terms of integrative medicine in the hospital, it may look a little different. But at TGH, we offer all modalities that help with non-pharmacological pain and anxiety management. So we offer medical music therapy. We have musicians that come to the bedside that play guitar and the mandolin and sing to help alleviate anxiety. Sometimes we have patients that are depressed and flat. So depending on their, demeanor and what we're trying to treat, we will use uplifting music or relaxing music. We have a licensed massage therapist that sees patients at the bedside that provides therapeutic touch to help with muscle tension, circulation at the bedside. We see a lot of benefit with our ECMO patients as well with massage. And then we have art therapy as well. So we just recently added an art therapist that comes in 2 days a week and offers art therapy with patients, which is popular amongst our pediatric patients in the form of, emotional release and expression. We also do tons of mindfulness from guided imagery, body scan, breath work. And I also do auricular acupuncture on select patients to help balance the nervous system. We have a volunteer right now that does reiki. And so those are our current modalities that we offer at the bedside. It started off really small years ago when nurses were just asking for another way they can help patients alleviate pain and anxiety. And it was more of, hey, can you help this patient? And then over the years, it's grown into, official department, and we have a consult that's Order and Epic. And so a patient has to have a consult put in for us to see them. Usually it can be placed by a social worker or RN or physician or a PA or APRN, and then signed off by the physician. And we usually see the patient within 24 hours of when the consult was placed. And we offer our care. We introduce our program services. Sometimes certain cases are better fit for certain modalities. Sometimes we go by patient preference. Sometimes they are familiar with our services. And so that first initial visit we see with the patient, usually I do most of the initial evals. I'll evaluate the patient, explain all the modalities, and based on their condition, what they feel, and preference, then we'll connect them with one of our practitioners. We usually give patients about 3 to 4 good sessions before we sign them off to make space for our new consult.
Love that. Like on one hand, it's Tampa and it's Florida, right? And that was like the big reason Mira and I moved down here was because it was such wellness focus. Like you mentioned Tampa Well, you go on their website and it's awesome, like dancing and different movement patterns that they'll have for classes. So on one hand, I'm like, okay, yeah, this absolutely makes sense at TGH. But on the other hand, I'm thinking it's still an acute care hospital. Like, how do you actually get buy-in on these patients? And then my follow-up to that too is what type of patients are typically being seen for most of the time? Is it really just on the floor? Are we looking at critical care patients, cardiac, et cetera?
Sure. So we get consults from everywhere, every wing of the hospital. We see patients in the NICU. We see a lot of L&D patients and provide massage and mindfulness. We see oncology patients. We have a great relationship with our palliative care team. So we see a lot of end of life, transplant, all the ICUs, so delirium patients. So we are consulted on every wing of the hospital and have grown. The buy-in, a couple of ways. So one, I think that we have a few of our departments and physicians that work well with us and have used our services and have seen the benefit and have had good feedback from their patients. And so we have those few that will consult us on every single one of their patients as when they admit the patient. And then we have patients come in that, might be frequent flyer or coming back in that will request us. And another thing is that we are doing research on pain and anxiety scores. And so because that's mostly our reasons for our consult, to help the patient improve their pain or anxiety. And so we have a few years, 2+ years of data to show that when we intervene with whatever our modality, music, mindfulness, massage, 98% of our patients report an improvement in pain and anxiety. And there's about a 4-point decrease in their anxiety score and about a 3 in pain. And we're now taking it a step further and looking at, okay, if we're having, most patients say they're improving their pain and anxiety after integrative medicine session, does that equate to using less narcotics and less opioids? From our just preliminary look at it, it does show promising, but we're working with a statistician and research committee to kind of look into the data in detail. There's a lot of limitations. There's a lot that happens in the hospital. And so we're just making sure that we interpret it cleanly and clearly. The other thing is that we do, which I feel is most important to help get buy-in and get people to really believe in integrative medicine modalities, is they need to experience it themselves. And once you have an experience of how, doing a deep breathing exercise or how a meditation session can really alleviate stress or anxiety or bring down your heart rate or improve your blood pressure, I think people, when they experience that, they really get a deeper understanding. And so we host events at the hospital called Mindful Monday. We try to do it a few times a year, but it's our way to give back to our nurses and our staff. And we have our whole team. We book out the auditorium and we provide all the care that we do for our patients to our team members. And so we have our massage therapist. I'll do mindfulness and acupuncture. We have our musicians in the middle singing and playing guitar. We have reiki. We have our art therapist. And it's a service that nurses, staff, physicians, team members can come, sign up, enjoy, and experience one of our sessions. So we try to do that so team members experience what we do and feel the benefit on their own, which I think is, powerful. When you experience it yourself, you tend to believe in it more.
You obviously have goals when it comes to outcome scores, right? I mean, pain level decrease by 3 is huge, right? I mean, that can take you from a severe to moderate or moderate to mild, and that can actually change the course of discharge and what you're going to be prescribing. Aside from looking at, clinical scores and clinical outcomes, how much are you also looking at changing the culture, right, of TGH and adding more of, again, integrated alternative, but just not Western medicine? I mean, how much of that is on your mind when it comes to trying to build this program out?
Yeah, I think, I think changing the culture as a whole has been more slow. And I think that you do it in, bits and pieces. So I think growing our integrative medicine department is one. We have steadily grown each year. And so we're getting more and more consults from previous years. So there's more awareness. The Mindful Monday events, I think, are helpful. Now looking at our food and our menu. So we're trying to slowly improve the awareness of all the pillars of lifestyle medicine. And one thing that we offer now, which is great because I wanted to bring up this program, is our MBSR program. And it stands for mindfulness-based stress reduction. It's a evidence-based, probably gold standard mindfulness program that's out there. It was developed by John Kabat-Zinn from UMass. And if you look up, MBSR for anxiety, MBSR for muscle memory, there's profound research with its benefit with mental health, chronic diseases, autoimmune conditions, tons of research. And the reason why it's been so studied and so beneficial is because there's a commitment. It's a 8-week program and you meet once a week. Each session is about 2 hours. And then every day you have a little bit of, homework to do on your own. You practice meditation. And each week, and you guys are welcome to join the next class. It's going on right now, but the next class will be in August. But each week you build on the practices that you learn. And towards the middle half, there's an all-day silent retreat where you practice everything that you learn. And it's all guided by a certified MBSR teacher. And towards the end, you learn so many tools that you can use, for the rest of your life. We have it available for our team members and it's heavily discounted for them. So there's incentive for them to join. And we have also created a shorter program because it is a commitment and hard to fit in, but we've created a shorter MBSR modified program called Foundations of Mindfulness. It's 4 weeks, an hour each session, but just kind of give you a taste of all the practices. And then hopefully you'll build on that and do the full MBSR. But we have a lot of these initiatives within TGH that, hone in on the pillars of lifestyle medicine, integrative medicine. So the food aspect, the stress, exercise, sleep, community with Tampa Well. And so I think culturally there's a shift, and we're fortunate that we have an administration and board that supports these initiatives. I think it just takes a little while. One thing that will help in the future is, having these services reimbursable, and insurance. Usually they're more strict on reimbursing big studies that are mostly randomized controlled trial studies. And that's where it becomes a little bit difficult with funding and why it takes a long time. That's why I think once we have our menu up and running and we start collecting the data and the research, that'll be an important step.
So let's talk a little bit more about that, right? So we often talk about the business of medicine driving the practice of medicine, which is a real unfortunate thing, but it's just the reality of the system that we live in. You mentioned how you guys were able to modify the nutrition piece to do that. And insurance companies, at least not to my knowledge, are looking at what's on the menu and making any adjustments there. However, some of the team that you mentioned, so the licensed massage therapists, to my knowledge, most or a lot of insurance carriers are not paying for massage therapy. So that Reiki, I don't think insurance companies typically reimburse for that. And then I also, I'm wondering how those clinicians, those providers, if I can use that term nowadays, are being paid for. And because I'm thinking about, okay, if we do roll this out, let's just say very optimistically speaking, 5 years from now, a lot of hospitals are going to have systems like this. They're going to want to ask those questions. You also said that you get the consult within 24 hours you see them. Is that you specifically, or are there other physicians who are integrative medicine and part of your team who are seeing these physicians as well?
It's myself and the team. So there's just one physician, and then we have 2 medical music therapists, licensed massage therapist, art therapy, other practitioners are all trained in an integrative medicine modality.
Got it. Okay. So tell me about that model, if you can,
Sure.
because hopefully somebody really excited is listening part of the system and says, hey, how can we implement this? Maybe there's another Dr. Tanuja out there who's going to go talk to the CEO. It's like, we got to implement this. And they're going to say, well, how? Give us a script.
So currently we don't bill patients. So none of our services that we offer, we're billing. So it's it's a wonderful free service for our patients. Because of that, and because we're not building revenue for the hospital, we're more passively saving, it would be unlikely, given the current climate, for us to grow and expand any more than we currently have, unless we get donation. So our current team is budgeted for my position and 3 of our practitioners. Our art therapist and any other practitioner that I would want to add on for, a few hours a week or part-time would be supported by our foundation funds and donations. So currently we don't bill. It's a free service for patients. We've looked at ways to potentially charge them, or we've looked at ways like that. But right now we want to promote and help and heal the patients, and we don't want them to be turned off if we add a fee associated with our services. I think in the future, there's growing push towards having a lot of preventative services, reimbursed. Currently, there's not much other than, smoking cessation and, cognitive behavioral therapy and those type of things. But in terms of nutrition counseling and stress reduction, and currently there's none, but there's a lot of movement and push towards doing that. I think that'll happen once we have more RCT research to support these benefits, because I think that's what insurance companies want to see. And I think when we need to shift the culture, as we've been talking about, for more of a preventative lifestyle focused, and incentivize physicians and especially PCPs on more of a value-based model than fee-for-service, and incentivize them with, looking at outcomes for chronic diseases. There should be focus on, more education on nutrition and these type of techniques in medical school. Most of the integrative and lifestyle and functional medicine docs have done additional training and fellowship beyond what you learn in residency. So I think, the research, the education, and incentivizing providers are the ways that we're going to move the needle.
Do you have the ability to work with residents or medical students?
Yeah, so we're affiliated with USF. So we have volunteers, shadows, residents, nursing students. Yes.
I'm assuming you're teaching them some of these techniques, you're teaching about the models. What are some of those resources that you use to help guide them, right? As you talk about the future of medicine. And I think about this all the time, because I think, when you look at Gen Z or you look at the incoming medical students, there is, I think, a big notion and big push to be more holistic, right? I mean, we're actually seeing more people apply to DO schools exclusively. And you never really saw them in the past. You always saw DO as a quote unquote backup or whatever it might be, but people are actually now wanting to provide that type of care. The issue that I find is once you get into the training itself, like you said, there's not much nutrition. There's not much education. You might get 2 hours on just integrative systems. And then once you get into residency, well, almost all your time now is just spent on the pathophysiology and learning and charting and documenting. How do you kind of separate that acute care talk with the integrative medicine?
So the residents and students that have approached me are interested in it. USF has an integrative medicine, committee. And so they're already, like-minded. Like you say, I think the 2 biggest organizations are American Academy of Lifestyle Medicine is huge. They have wonderful conferences. They have amazing materials. That's one, way to keep up with education. And then I did the fellowship through Andrew Weil, so the University of Arizona Center of Andrew Weil, Integrative Medicine. They have conferences. They have obviously the full fellowship, but there's other ways that you can get the content and learn and do CMEs. Those are the biggest, 2 areas. But I agree that the generation right now, we're focusing more on lifestyle and setting boundaries for ourselves, and just different mindset and approach, and looking at food and sleep and nutrition is much more common now than it was before. But I also think there's more of a need now than there was before.
Are you finding hospital stays getting shorter and shorter at TGH as well? Because that's what we're finding in the rehab. It used to be 2 weeks, moving it down. And so to me, it's almost like, man, how do we even have the time to really focus on some of these modalities and do education when beds kind of just keep getting turned over?
Yeah, definitely. I think there's always a push to get patients, out once they're stable. It's really expensive and to extend length of stay. So it's hard. That's why with our menu, we included those little nutritional tips and the education. But yes, there's only so much that you can do. And especially in the hospital, patients are not feeling well. Sometimes we're meeting them at one of their worst days of their life. They're not, completely, with it or, interested in listening, and they're just trying to get through the day. And so really most of the education and the real change will happen outside. But we're hoping to, if we all speak the same, language, if we're all kind of sharing the same message, we're hoping that they'll be able to, capture. And my team and I say, and I once a meditation teacher that I sat with, said something similar. Sometimes you'll sit and meditate for half an hour and you'll get nothing. And then other times you'll sit for 5 minutes and you'll get something. And so we, in the hospital, we see tons and tons of patients every day. And, maybe we'll get to 1 or 2 of them by the end of the week, but that still is such a significant change. And that could still, change their outcomes and change the way that they look at it if we're introducing them to breath work. What I have seen in the last several years, initially when I would see patients and say, hey, this is integrative medicine. These are some of our modalities. I can do a guided imagery and mindfulness practice. And initially I would get a lot of pushback with mindfulness and a lot of like, what is that? Or I don't believe in that. But recently, I'd say in the past year or so, it's a term that people are more familiar with. People are not turned off by it anymore. They've, tried it on their own. And so it's nice to see that change. And we're not getting pushback like we once were.
Tanuja, let's say that maybe there's somebody out there listening. He's a CMO of some institution, right? And I know that this is so exciting. I mean, you've talked about all the great things that you guys are doing. You're really offering a panel of just health. We're going to ask you this question, right? So we talk about hospitals being a place where people go when they're sick. And really what you're trying to promote is health. And I love the fact that it's not just for that short time that they're there, but you're also incentivizing them and providing them with actual resources to continue that journey. Because we talk about this often, like, when you leave the acute hospital after you go through an illness, you're going to the rehab facility. And that's when Darsh and I take over, right? And we take that baton from you. And then we remind them when they're being discharged, hey, this is going to continue. Hopefully you had a follow up with your, X, Y, and Z, your doctor, your rehab, maybe it's home care, whatever it is. But that journey is much longer than the interaction with the clinicians, the providers, practitioners they're going to have. So I think this is fascinating. And I'm wondering what message you have for the CMO or the physicians out there listening to really advocate for this. Again, I think we're all three of us are having this conversation because we're super excited. We love this, right? And there's a strong chance, I don't know you that well, but I'm willing to bet that you implement this in your daily life, and you have been for the last decade more so. And we had a bias coming into medicine with this, just to kind of piggy off of Darsh's thing, but not a lot of people do. And a lot of those administrators actually, I want to be too controversial here, they have slightly different motives. They have slightly different incentives. They're not in medicine for the same reasons that we might be. What will you say to them that they should really consider this, keeping in mind that you did use the word free, and free is hard. Free is hard to argue for those administrators.
I think that having access to whole, nutritious food should be a fundamental right. And I think that the reason why it's so difficult and there is pushback is because it's the access, and it's hard to implement all of these changes. It's hard to, get your 7 to 9 hours of sleep and meditate and drink your water and do, some type of stress reduction and eat healthy and go to the gym. And when our culture doesn't make it easy for us to do that, Our culture is very hustle bustle. You work, you come home, you're tired, you're burnt out, and one of those important lifestyle things will have to fall off. It doesn't become a priority. So it really takes a lot of attention, focus, and change of your whole priority to implement these changes on a regular basis. But one thing that we're trying to do at TGH through Tampa Well is create access to all of these community things so it is easy to exercise. It is easy to join this mindfulness program and have some stress and provide it kind of to everyone. And it takes time and it takes, effort and it takes work, but knowing the value and importance is that it's the way that the culture is right now is not sustainable. We're sicker than we've ever been. Our life expectancy is going down. We're seeing cancer, colon cancer in such young patients when we had to change the screening age. And so there's a need for it, and what we're doing right now is not sustainable. And so the shift has to happen to focus on prevention and reduction of chronic diseases.
So until that bright future comes, we're all excited where your mission is in a lot of different hospitals across the country, across the world maybe. What message do you have for the patient or the patient advocate when they go to the hospital to take some agency so they can be healthy for themselves? Because, maybe the hospital is not incentivized to do kind of what you're doing.
I tell patients this all the time, be your own advocate. You're your own doctor before anyone else. We don't all fit into a cookie cutter, treatment guideline. And in the hospital, when physicians are rounding, the team's rounding, we're providing the best care that we can in that moment. But I tell patients to speak up for themselves all the time, do what they think is right for them, and ask questions. And
you brought up sleep. The hospital is the absolute worst place to get any quality sleep. And we know how important it is when it comes to recovery. I worked this past weekend, and I think the number one complaint the 41 patients that I saw was just, I can't get any sleep. And I asked them, well, my first question is that normal for you in the sense that do you struggle with insomnia? A lot of these patients are older patients at home. And the answer is no. And I know we all get this joke, and maybe a rehab nurse is out there listening. The idea of, nursing going to wake up a patient at midnight to ask them if they're in pain, and then they can give them their scheduled medication. It is the funniest and most asinine thing but it keeps happening. So, I digress. Let me come back. I don't know if I heard you talk a lot about that and how to promote good sleep quality, especially in the acute hospital setting where there are more frequent blood pressure checks, vitals, all that kind of stuff. From an integrative medicine standpoint, you recognize the importance of it. How do you communicate with the team, the nursing, the staff, like, hey, sleep's important. Let this person sleep.
I think, again, so some of our modalities that we do help patients with sleep. And so when we come in, I'll ask them what they're feeling and what, I always ask them how they slept. Most of the time they said they haven't slept. And I said, do you want to rest right now? Do you want to take a nap, or do you want, and I'll turn off the light. We'll dim all the lights. We'll create the ambiance. We use essential oils as well. And I'll guide them through mindfulness practice and allow them to sleep. And most of the time they end up falling asleep. And then after that, we do communicate with the nurses and say, hey, can we just hold off and let this patient, take a little nap? They just fell asleep from our session. In terms of the blood pressure and the lab draws, and, that is unavoidable. And I think the only way is the patient, again, to be their own advocate and demand for it, because there's a lot of turnover with nurses and staff. And there's a lot of new nurses that come in that are just going to follow, they're just going to follow the guidelines, and they're going to follow, if I'm doing this Q2, like they're going to follow the rules. And that's it. Patients need to use their voice and speak up and say, hey, if this is not absolutely necessary, can you please let me sleep from, 10 to 5? And there are patients that do that, and nurses that recognize that might be more seasoned. And there's notes on the door, please don't come in unless absolutely necessary from 11 to 5 or whatever it may be. So I see that a little bit, but for the most part, it's going to happen unless you speak up or if you have that conversation with somebody from the care team.
Yeah, no, that definitely makes sense. And I don't know if it's a regional thing. I've noticed in Florida, at least, patient autonomy and letting them kind of advocate for themselves has been much of a bigger thing compared to the Northeast for some reason.
Oh, really?
Like, I don't know
Okay.
if you see that. Like when I trained in Philly, Hershey, it's a double-edged sword. I mean, a lot of the times the patients would try to advocate for themselves, but we'd almost force upon kind of the reasoning behind why things have to be done. But I don't know. I don't know if it's a regional thing or
Interesting.
whatnot.
I would honestly think the opposite, but that's interesting.
I don't know. I did want to circle back to the menu for a second because I did have a question. Obviously, the food pyramid, there's a new one that came out.
Oh, yes.
How much do hospitals, because through our research, actually today, we just released an episode on our take on the guidelines in the new food pyramid. Through our research, we realized, military, a lot of the welfare programs, they kind of abide, school programs, they abide by the guidelines. Do hospitals have to follow anything from, these governmental guidelines at all?
We are trying to, focus on research first. That's where our administration kind of relies mostly on research and physicians and those organizations. So we try to abide in general to the guidelines from the government, but we are more focused on the research. And that's why the Mediterranean anti-inflammatory diet, the research is there and it's profound. Yeah.
Have you gotten a chance to look at the new food pyramid? And
yes, yeah.
Do you have any thoughts on it? Yeah.
Yeah, I think from an integrative and functional medicine perspective, I think there's positives and then there's some concerns. The positive that there is focus on whole nutritious foods, so that is a positive. That is something that we speak of all the time, and that's something that there's evidence for and we believe in. A reduction of ultra processed foods, and that's that's a no-brainer as well. The way that the pyramid's written, they kind of emphasize red meat and dairy, and I think it could be a little misleading that somebody looking at it could think that they should eat more red meat and more dairy, and we know that based on science that's not health promoting, especially red meat. We know it's very inflammatory, high in saturated fat. This is going to increase your LDL, increase heart disease. So I think that aspect of it would need a little tweak and a little misleading. There's also there's less of an emphasis on legumes, lentils, fiber, and more emphasis on meat protein. And we know from tons of research that plant protein is the most anti-inflammatory and will reduce chronic diseases. And fiber is really essential for gut microbiome diversity. And one thing that I think our society is just very obsessed with protein. we're just a protein obsessed society. And that's what people talk about, like how much protein all of us. And I look at, look at that myself as well. But what the actual study shows is that it's really actually very difficult to become protein deficient. And what most of us are actually deficient in is in fiber. And fiber comes from our vegetables, our fruits, our lentils, legumes, etc. And blue zones, I'm sure you guys are familiar with blue zones. One of the good thing about beans and lentils, legumes, that it's easy to make and it's very affordable. And so it's considered a longevity food. And so that is not represented in the food pyramid as well. And it's more focused on protein through meat and high quality meat, which is good. But I think that having access to high quality red meat and dairy is difficult for a lot of people. And so when you look at the food pyramid, it might look like you should eat more of it. And if you can't get good quality, it could be detrimental.
Tanuja, I want to push back a little bit. I think that I agree with you. Probably the protein craze has gone a little bit too far. And Darsh and I have talked about this a lot. I think, and earlier we were probably guilty, maybe even now we're still a little bit guilty of recommending, my recommendation, depending on the person, is certainly well above the RDA recommendation of 0.8 grams per kilogram. And although it might be harder to be truly in a negative nitrogen balance, truly deficient, when it comes to thriving, we are deficient. Because it's going to be really hard for most people to thrive with 0.8 grams per kilogram. Certainly fiber is more important. Like I think from a medical standpoint, when you look at the word deficiency, from a medical deficiency, yeah, fiber, we're there. Like I would agree, because I think the average person less than 10 grams a day, and the recommendation is 20 to 30 grams a day for an average adult in the United States, right? So yeah, most people aren't even getting 50% of that. So from a medical standpoint, I agree. But I think as the last question is going to suggest, we're interested in a different game here. And then bias also plays a big role into it, right? I think a lot of the literature that you're talking about, when they talk about animal-based products and protein, it's coming at looking at some of the cardiac inflammatory markers long-term. To my knowledge, they're not weighing a lot of times when we're looking at muscle. So Darsh and I, maybe I'll just speak for myself, Darsh, you can speak for yourself here, but we're physiatrists, right? And actually, your husband is a physiatrist, right? So these people are coming in, and sarcopenia is a real problem. Somebody breaks a hip after the age of 65, the chances of mortality are nearly 50% within a year or two afterwards. Them not making it back home, like all these things really, really matter. And muscle is the most important thing to counteract that, right? To protect you against that. And in order to have, to combat anabolic resistance as you're getting older, you do have to consume more than 0.8 grams per kilogram. All of us, I think maybe we're probably in our 30s, 20s, probably you look very young, Tanuja, we're going to need maybe a little bit more than that, especially if we're more active. And so the 0.8 grams per kilogram recommendation, yeah, most people are probably meeting that, but it's like, what game are you playing for? So I always ask, like, why can't we do both? Why can't we take more protein and take more fiber?
Sure. And I agree with that. I think if someone's coming and they're like, I want to, live optimally, and I want to thrive, and I want to, yes, then we'll have the conversation on everything. But if they're coming in and they're nowhere near what they need for fiber, and they're just focusing on protein and obsessed with that, and that's what I see a lot of, then I'd say, hey, why don't we hold on the protein for a second, do what you're doing, but why don't we add in some lentils, legumes, vegetables for, that has a lot more benefit. And I think I'm a plant-based advocate, but I'm not against meat by any means. But I feel like for those patients with sarcopenia and people that need to gain muscle fast, yes, you're going to gain muscle faster from non-plant-based sources. But and it's harder to gain muscle mass using plant sources. But if you do it right, you can. Some of our strongest animals are herbivores and don't eat meat. So Darsh is extremely fit and has a lot of muscle. And from what I know, you're whole food plant-based for the most part. So there's ways to do it.
Darsh is not strong though, so.
So there's ways to do it, but bisons and apes and, all these animals are horses are strong and they don't eat meat. So there's way to do it. But in situations like sarcopenia and these medical interventions, yes, adding a good meat source could be beneficial and helpful and quicker to add the muscle mass.
Yeah, that's fair. Yeah, it's really unfortunate. And I guess I was really speaking more to the scientists and the clinicians who were engaging in these debates. I think from a coaching perspective, what you're talking about, simple is sexy. And so telling a person, hey, let's just focus on this and, one thing at a time. I think that's just coaching 101 if you want them to be actually successful, not say, hey, let's increase protein while increasing fiber, while do this. You know that when you give somebody multiple things to do, the failure rate's going to be really high.
You have to meet them where they're at and make it realistic. And I always tell patients, it's not about how much you do, it's the consistency. So have a rule for yourself, 80-20. I follow the 80-20 rule, 80%, mostly 90% of the time, I'm eating clean, I'm eating at home, I'm eating what I need. I have a personal goal of getting to at least 5 to 7, if I can, vegetables and fruits a day. I'm, here and there. Yes, I'll go out and eat and, indulge, but it's what you do on the regular basis and make it consistent. So if someone's eating fast food every day, I'm not going to sit there and talk to them about making lentils and, a vegetable chili, or, we're going to meet them at where they're at and say, let's reduce your soda intake from every day to every other day, or whatever it may be.
Awesome. I love it. This is why we do the podcast, to add nuance, add these conversations. We have different people, high performers, patients, your average Joe. So love it. So let's land this plane. Tanuja, you've been very generous with your time. People are going to listen to this. And again, like Altamar said, we might have some healthcare providers out there that are saying, how do I think about this? How do I implement this? Is there somewhere that they can go and learn more or reach out to you?
Yeah, absolutely. So they can message me. I have a professional Instagram. It's Tanuja Sharma, MD. They can reach out and look at our Integrative Medicine and Arts website, We have all of our information on there. There's a link for MBSR, the mindfulness-based stress reduction. That program, again, it will be offered again in August. There's information, video, media, interviews, things on the website too. So those are some ways they can kind of connect. And TGH, we're trying to, set a good example for lifestyle medicine, food is medicine. We have these programs in place. And, once we have the research to share, we're more than happy. We have an amazing, our Tampa Well community outreach program is amazing. We have really great leaders that are happy to share our work so we can spread the knowledge.
Awesome. Yeah, we'll definitely link it in our show notes for everyone for easy access. So what is next for you? You've just accomplished a huge project, but I know you're a high performer. You're probably already thinking about what to do next. What is that?
Yeah, I think, to move the needle with funding, we need to do the research. And so the two research projects that I'd really like to see come to life and have good outcomes is the effects and outcomes on our new food menu, and then whether our patients show reduction in opioid and benzos. I think if I could publish those and show those, I think that would be huge.
Awesome. Perfect. Well, before we ask you the last question, just want to say thank you so much again for your time. Truly an inspiration. And, I hear it from our friends, our mutual friends all the time too, about all the work you're doing. So it's super awesome to see it.
We happen to have the research to share. I'll come back and share it with you all.
Oh, absolutely. We'll definitely do a second part to go over all that. But our last question we ask everyone is, how do we put the health back in healthcare?
I think it comes from yourself and practicing, what you preach. And so I think looking and analyzing your own health and your own, and people define it in different ways. So I think the first step is actually reflecting on what health and what wellness means to you. When I think about health, I always think of the word balance. So when I feel balanced, I feel healthy. And the way that I feel balanced is if I get enough sleep, if I've done something in the day to help alleviate stress, if I've eaten well. And so I think looking at yourself and thinking about what does health and wellness mean to me? And when was the last time I felt healthy, and start implementing those in your life.
Amazing.
Thank you.
Thank you so much, Tanuja.
You're welcome. You're welcome.
Thanks for listening to another episode of Medicine Redefined. If you enjoyed this episode, please be sure to check out some of the additional resources in the show notes. Please also check out our social media platforms where you can find more content like this. You can follow us on Instagram, Twitter, and TikTok at MedRedefined. We also want to thank our team for the production of this podcast, specifically Ethan Ju on video, Harita Yepuri on social media, Zainab Lugmani on research, and Sarah Khan for newsletter. Oh, and if you want to get similar bite-sized information delivered to your inbox every Sunday, please be sure to sign up for our newsletter. Also, if you enjoy the show, please be sure to subscribe, review, and share with anyone who you think will gain value from this as well. Now, time for the ever so important disclaimer. This podcast is intended for general public use and is for educational purposes only. It does not constitute the practice of medicine, nor should be construed as medical advice. No physician-patient relationship is formed, and anything discussed in this podcast does not represent the views of our employers. We recommend that you seek the guidance of your personal physician regarding any specific health-related issues.